I always knew I wanted to become a doctor. I was the ultimate South Asian nerd who studied day and night and graduated as valedictorian from high school, college, and medical school. I was totally living the American dream, working hard and succeeding. But I almost didn't make it through residency because of a thyroid problem. I'm here before you today because I was able to get proper help for my thyroid. An interesting thing happened to me during medical school. I was the dummy for everyone to locate the thyroid gland on a patient. You see, my thyroid was so prominent that they used me. The professor would say, "Okay, everybody, come here and feel Riffet's thyroid. See that bulge in her lower neck? That's her thyroid." As I'm being poked and prodded like a cadaver, I'm thinking to myself, why do I have an abnormal thyroid? And why doesn't anybody think it's a problem? If it's so abnormal, how could it possibly not be a problem? And so this led to a series of doctor visits for me. But all the doctors would tell me was, "Your thyroid is borderline. No treatment is necessary. Come back in 6 to 12 months, we'll recheck." Over and over again, that's what I would hear. And I just kept moving on with my life. After medical school, I got married and started training to be a surgeon at the Johns Hopkins Hospital. And then things changed. I would come home from the hospital and be so exhausted that all I could do was sleep. My energy got so bad that every step I took required a sheer act of willpower. That's how little energy I had. My poor new husband got no time and zero attention. Needless to say, this created problems for us. Our marriage almost didn't survive to the first anniversary. This also had a hugely negative impact on my career. In fact, it got to the point that they were actively looking to replace me. So I thought, now my thyroid must surely be a problem, and I went to a doctor to have my new symptoms and still large thyroid checked. But again I was told, "Your thyroid is borderline, and there's nothing to be done. You're having a hard time with residency, because surgical residency is hard, especially for women. You might want to consider another specialty that is less demanding." In that moment, I saw my dreams shattering. Fortunately, someone recommended I get a second opinion. This time, I was put through a more extensive battery of testing beyond a TSH level, and it was determined that I had an autoimmune problem with my thyroid known as Hashimoto's disease. This doctor said that even though my lab results had been borderline, I was having enough symptoms that I should be treated with thyroid medication. So Synthroid was prescribed, and at first it seemed to help. But over a few months, the fatigue came back. Even though my TSH blood test was now completely normal, it was no longer borderline. I continued to have a very hard time keeping up with my duties as a surgical resident and was always trailing behind. To my good fortune, a professor of mine from medical school had recently developed a revolutionary new way of evaluating and treating low thyroid function. Dr. McDaniel taught me how to optimize my thyroid hormone levels and thereby my energy. Suddenly, I was leading 5 a.m. surgical rounds and had energy left to spend quality time with my husband. This saved my marriage and my career. This experience taught me that the best way to practice medicine is to listen to the patient, never hesitate to go beyond the standard of care, and always seek out better ways. Clinical guidelines are just that, guidelines. Each patient must be treated individually. I'm grateful that I found help before it was too late. And I am most grateful for the privilege of helping others optimize their health. Thank you for listening. This is Dr. Qadir.